Welcome to the Healthy Hustling Podcast. I have today joining me Dr. Hayley VanBeek, who's a physical therapist at Fuel Health and Wellness. She's been with Fuel now for 4 years, has it been, which is crazy. She specializes in pelvic
Yeah.
floor therapy. She's expecting baby number 2 on the way here. So we are going to talk about when to see a physical therapist, who should see one, when to see them. And then also, I would say even what's more important than that is what to expect at physical therapy. Like, how do you even choose a physical therapist? Do you just choose anyone that's a physical therapist, or how do you go about it? So I feel like this information will be jam packed for anyone that's dealing with any nagging injury that wants to get to the heart of it and make sure they're getting good care and healing as quickly as possible. So thanks for coming on, Hayley.
Yep. Thanks for having me.
Awesome. So let's kind of get right into it. As far as the first thing is, who should see a physical therapist and when should they see a physical therapist? What's typically your answer?
Really anybody who's having an ache or pain or recently injured themselves, or maybe they've been dealing with something, for a long time. Um, and especially even those who are having like very extreme pain, or they think that maybe they have broken something, like you may actually need to see a PT instead of going straight to like the ER. You may not actually need to go to the ER. And I think some people, right, like you've seen that too. We get asked that question a lot. So
Yeah. Yeah. So one of the really nice things that I always tell people too is we have what's called direct access now. So back in the day,
mhm.
you needed a referral to go to see a physical therapist and everything like that. And now you can just walk straight into a physical therapist's office, at least in the state of Michigan and certain states. I believe it's most states now, but you can walk straight into a physical therapist's office and get an evaluation. Um,
Mhm.
Now, there are some different laws regarding direct access depending on your state, but that is what's available, especially here in Michigan, where we're located. You can come in, get an evaluation, get treatment, and get going right away. So, you know,
Yep.
if you broke a bone, yeah, we're going to want to make sure that you go get some imaging on that right away.
For
But
sure.
if you have a nagging injury or you tweaked your back, even like a tweaked back is a prime example of just get right in and see a physical therapist. And usually, the quicker you get on top of that and you get in to see a
Mhm.
physical therapist, the better outcomes that we're going to have. We're going to be able to get that pain settled down a lot quicker. We're going to get it under control so it doesn't continue to persist and possibly get worse.
Yep.
So what I tell people too, a lot of people, well, don't I need to rest? The Sometimes, yes. Now, if you've been resting for 2 weeks or more and it's not getting better and still there, then that's typically an indication that you need some professional care on that. Would you agree with that?
Yeah. Yep. Um, Even I would even say like 1 week, but I think could could potentially waiting, could your symptoms go away? Yes, but um, I feel like we can make a really significant change, whether it is pain relief or just speeding up that healing process by giving you the proper things to do, versus having you wait it out and have the potential of that injury or issue just last even longer,
Yeah.
I guess. Hmm.
Yeah, I completely agree. And like you said, as far as getting in with even the first week, I mean, we've had athletes come to us who they've gotten hurt in the gym or during their
Hmm.
training, and they've gotten in to see us within minutes of it happening, and we're able to typically make sure that they're on the right track at least to heal as quickly as possible and get them
Right.
not only relief. Again, relief's one thing, but then make sure that they are set up to heal as quickly as possible, and that way they don't have to wait hours to get into a doctor who's then just going to then refer them back to physical therapy, which is
Yeah.
oftentimes what we see is people are saying, well, shouldn't I go to my primary care doc? You can, yeah, absolutely you can. But typically, what they're going to do is then refer out to physical therapy or tell you to
Hmm.
rest. Primary care docs are great for triaging an issue, meaning
Yeah.
you come in and they're going to typically recommend unless it's the flu, right? They may give you a little bit of
Yep.
medications, and they might give you some medications too for a muscle relaxer, but they're typically then
Yep.
gonna send you off to a specialist like a physical therapist to get an eye on it. So
Yep.
that is typically what I recommend to people. Now let's get into, are all physical therapists created equal, and how do you make sure that you're seeing the right physical therapist for you and your injury? So, for example, I will say, you, Hayley, you're a pelvic floor therapist. I am
Mhm.
not a pelvic floor therapist. So while we're both physical therapists, you're going to be much more knowledgeable about pelvic floor and how to treat that than the
Mhm.
average run of the mill PT, right? Um,
Yep.
how else, would you explain with regards to how do you see a physical therapist, even maybe outside of pelvic floor and that specialty?
I mean, I guess it can go for any specialty. So I guess we can also use here, for instance, for athletes, um, right? People who are higher level, um, that are, whether you're a professional or just like, an active adult or a CrossFitter like we work with here, um, going and seeking out a physical therapist who works with other people like that or works with that population versus just going somewhere where maybe they see a lot more of like post surgical, for instance, or, the geriatric older population. Um, Again, not that they can't help, and do a good job, but you're gonna get better care going to see someone who's got the experience and the knowledge base of working with what you
Yeah.
do for a living. Yep.
Yeah, I would say definitely, seeing someone, if you have someone you already like, know, and trust, go and see that
Yeah.
person. If you already have a good relationship with them and everything like that. But if you don't have that good relationship, I would look at for sure who are other people like you that they treat. So if you're an athlete, making sure that you're going to a physical therapist that sees a lot of athletes, just because they're going to know more about your situation. They're going to be more likely to know about your sport. They're going to be able to give you tips and education and also interventions that are going to be more suitable for your situation.
Hmm.
And what I also tell people to look for too is kind of the model that the physical therapist goes by. Are they seeing all one-on-one treatments, meaning you're the only person that they're seeing during the time
Yeah.
that you're in there? Or are you one of many? So there's different models of
Or are you
business when it comes to
seeing,
physical therapy.
I
What
was
was
gonna say,
that?
or are you I was gonna say, or are you seeing a physical therapist only one time in the beginning and then you're seeing techs or aides?
Yep.
So yeah. Hmm.
Yeah, one thing that we see a lot of in our area is, for example, patients will, for us at Fuel, we only treat one on one. And sometimes it's half hour, sometimes it's hour. It can depend on the person's situation and really what they need. We really customize it to the individual's needs and care. But
Hmm.
we only see people one on one because we want to give our patients our undivided attention and be able to get them as good of results as possible. We believe that time is extremely important, as well as, I mean, you're paying for physical therapy. And even if you are using, for example, if you're like, well, it's free through my insurance, you pay for your insurance or your employer's paying
Yeah.
for your insurance. And if you're utilizing that care, your premiums are more likely to go up the next year. So you will see an increase in costs one way or another. And so we want to make sure we're getting the most out of that time is extremely, extremely important. And just to make sure that people are getting good results. Now, that's our model on what we do. Other models on other therapists that we see very commonly are they go in, they see the physical therapist for the evaluation. PT does the evaluation, And then on those next visits, or even maybe that same day of the evaluation, the PT will tell the tech, a
Mm-hmm.
physical therapy tech or assistant, hey, here are the exercises I want them doing. And they give them a piece of paper, and a tech will take them through the exercises. Techs can range from anyone from a high school or college student to someone, they may or may not have a degree. So
Mm-hmm.
sometimes that's beneficial. You might have a tech that's really good, and you might have a tech too who, again, they're a high school or college student. They're still learning about anatomy and the body, and they don't necessarily know what cues to give with that exercise. Like, are you doing the exercise right or wrong? Tech may or may
Mm-hmm.
not know. And so
Yep.
making sure, with those models, though, a lot of times they have to get so many patients in through the door. That's why they're handing them off to a tech. And some people get great results with that care. Um, and other people sometimes can struggle a little bit because, again, they're not getting undivided attention. Um,
Yep.
what are your thoughts on that?
No, I agree with that. I think especially I feel like we will see people who maybe had gone through that model of care and it didn't work well for them. And again, it's not that it can't work for some people, but I do think it does play some of those athletes specifically, or people who are more active, who are doing like, crazy things on the daily. It's not as great of a model on average for them, right? Because they don't get that targeted one-on-one care, or they may not. I think the other caveat is maybe, let's say they want to get back to running or heavy lifting, and that facility doesn't, have, again, the training capability or even the equipment that's needed either.
Yeah.
So they kind of get capped out.
Yeah.
So
I
yeah,
would even say though too, some post, after surgery cases where, what I have found
yeah.
is that if people are going into these and the physical therapist is seeing multiple patients, or, maybe you're seeing a different physical therapist every single time, is the physical therapist checking in with you to make sure that you're where you're at with regards to your protocol? Are they measuring your range of motion every time? Are they checking your strength? Are they making sure that you're doing your home exercises? Are they updating the home exercises, or have you been doing the same home exercises for the past 3, 4,
Mm-hmm.
5, 10, 12, 20 visits? It's not uncommon that we see that. So just making sure that you're getting the attention that you need, and you're not just being treated like a number and being, there a box isn't being checked. You walk in the door, cool, they showed up, box, here's your exercises, go through them. Make
Yep.
sure if you tell me if you have any pain or issues, let me know. Make sure they're doing more than that, right? That they're, hey,
Mm-hmm.
how are your exercises going? What have you been feeling? Are these still difficult? Do we need to change them up? Right? Are they easy now?
Yep.
Because if the exercises are like, it's a piece of cake, probably need to switch them up, right? So,
Yeah. And I feel like they shouldn't be the exercises you're doing in the gym shouldn't be the ones that you're doing in the gym, sorry, like, or at physical therapy shouldn't also be the ones you're doing at home every single
mhm.
time. Like,
I
what's the
completely
point
agree with
of
that.
them being at home if you just, or what's even the point of going if you're doing the same exercises at home every single time?
Yeah,
I mean,
if you're
obviously,
doing, if the physical therapist gives you, for example, bridges and straight leg raises on the very first visit when you come to see
mm-hmm,
them as a part of your home program, but then you come in and 5 visits later, 10 visits later, whatever, you're doing bridges and straight leg raises in the
yeah,
physical therapy clinic and at home. Why even go to physical therapy when you can do those at home? So that's
yeah,
also, to me, that's my challenge to other PTs, is to like do better and make sure that you're giving
mm-hmm,
individualized care, because that to me is definitely a waste of time. You don't need to be doing the same exercises unless they're being progressed. So if you're doing, for example, a
yeah,
straight leg raise and you're not having any weight, and then the physical therapist says, hey, now we're going to add weight to the ankle and we're going to see how you tolerate that. I think that then is very important, right? Can
yep,
you do it properly with now the added resistance, and we're tweaking it a little bit. But if you're doing it the
yeah,
exact same way at home and at PT, you
without
should
any
bring that to the
change.
therapist's attention and just say, hey, I'm already doing these at home. Why do I need to do them here? I would recommend bringing that to their attention.
Yep, I agree with that.
Yeah. What are other good ways for people to find a physical therapist that best suits their needs? Like if they don't have anyone that they know that's been to physical therapy, do they go off of a doctor's recommendation? Do they ask the doctor? Like how do you
I
recommend they
mean,
find them?
they can, but I mean, I think what everybody does these days is just Google it. You can search specifically for what you need. If I keep using an athlete example, but if you're a runner, or you're a CrossFitter, or you play football, or whatever it is, you can search specifically for physical therapists in your area um, that treat those sports, I guess, or
Yeah.
specialties.
Yeah, I think that to me, I think that's the best way to go about it too.
Look
I
at their
would
reviews.
personally rely on a physician's recommendation. You can absolutely. I would just make sure that, a couple things with regards to that. So if it's a big hospital system and they're saying, well, you need to go see our physical therapist, do they even know the physical therapist that you're going to see? Because there could be, right, 100 different physical therapists. They're not all
Yeah.
trained the same. They're not all created equal. And if
I mean,
it's
they're
that
trained
the physical
as,
therapist is just going to stay in touch with them. I mean, we stay in touch with physicians probably better than I would say most people that stay in a hospital system, just because a lot of times we'll have the doctor's number, we can text them. So now
I
if
mean, but
the
essentially healthcare is a business. So of course that doctor's going to refer you to go in the same network or the same
yeah, they're
place. They're
incentivized.
encouraged, right? They're encouraged, incentivized to do that. So that's why, again, yeah, they're probably going to refer that way,
Yeah.
but
So
it is
I would
kind of
say
up
though,
to you
if
to
the
do your due
physician says,
diligence.
hey, go to this physical therapist, if it's a specific physical therapist, I would just say, do you see good results with them? Why do you recommend this physical therapist? Just ask a couple questions. It doesn't hurt to ask, right? Be your own
Go look
advocate.
at
You need to do that. But then
Google
absolutely
reviews.
Google.
Yeah, you can go look at their Google reviews.
Yeah.
Um,
Google reviews
I
and make sure too that I would say the Google reviews show that specific physical therapist. And for example, if
Yeah.
you're a runner, type in physical therapy for runners, get a list of like five of them, look through some of the reviews, see do those people match up with you, right? Are the reviews how do they stand out? And then is there a specific name to the physical therapist
I
that's
mean,
working with runners, for example, and
you can
request that
even
specific person?
yeah, you can even call the office and ask, like, do you have a physical therapist in your office that works specifically with runners? If so, I want to be on their schedule.
Yeah.
Like it's easy as calling the front
And
desk.
uh,
Now they
a
yeah.
red flag to that I would say would be call them and ask them, and if they're like, oh, all of our physical therapists work with runners and they have 10 different physical therapists, right? They're a very big physical therapy clinic.
Maybe
They
specialized
might
is a
not
better word
be
to say.
you might get the
But
physical therapist that works with all the runners. You might get the physical therapist where they see a couple runners a year, right? So
mhm.
that definitely can vary. So yeah, if
I
you're a
think
CrossFit
too the
athlete,
other thing,
go
but
ahead.
sorry, but I'm going off of even thinking of pelvic floor, specifically, because obviously, right, you're gonna want to go if you have a pelvic floor issue or someone's referring you to go see. I've had people come and find me because they were referred to a pelvic floor therapist in their network from their doctor, but unfortunately they couldn't get in to see them for 3+ months because that's a really high need and there's not as many people who specialize in that. So you don't have to wait, to see
Yeah, you should
that.
not wait three
You should
months to
not
get
wait.
in.
You should search and see if there's, anyone else out there that you can get in with, like me, for instance.
Yeah, you should not wait 3 months to get in
No.
at all. So even if you wanted, if it was a specific person, you could always ask to be
Hmm.
put on a cancel list or go see another physical therapist for that time
Yeah.
being for the 3 months. And then if you're still having issues, right, and that person's spot opens up and you can get on their schedule, then transfer over care. You could always kind of
Hmm.
bridge it that way too. Those are a couple ways
Yeah.
to, I would say, get the care that you need, at least some type of care sooner, because you should not have to wait.
No.
Um, you really shouldn't even have to wait 2 weeks, like a couple days, maybe. but you shouldn't have to
Yeah.
wait
Sometimes it's a little different
2 weeks,
in
two
some
months.
rural areas, right, where there's a little less often, but still, yeah, again, you should be able to search or like for instance, I can even and you do the same thing with virtual care. Like that's a great way to help people still, even if they do have to wait and they're not like close enough to you. There's still a lot of education and things that can be done virtually while they're waiting for that appointment, for
Yeah.
instance.
Yeah,
Mhm.
absolutely. I think that this was really good and answers a lot of the questions that we get
Yeah.
about when to see a physical therapist and what physical therapist to even choose. Any other things that you want to add before we call this good?
I don't think so. Yeah, I think moral of it is just I try to be your own advocate and yeah, do some searching and we're always more than happy like to answer any questions that people bring up or ask. So yeah, don't be afraid to ask questions is what I would
Cool.
say. Mhm.
Awesome. Well, thanks for coming on, Hayley. I think that this was really good. If you're watching this on YouTube, I believe Spotify can do comments now too. If you have any questions, please put them in the comments below and we will get to those questions. And if you need to reach out to myself or Hayley, you can visit our
Mhm.
website, fuelhealthwellness.com. You can also call or text us. The easiest way is 616-757-0932. That goes to our whole team, and then we're able to see it, or our team can see it and help get you those answers and answer any questions that you have right away. So again, you can call or text 616-757-0932. Um, and then Hayley, what's your Instagram if people want to follow you on Instagram?
Oh boy, you're gonna test my I think it's Dr. Dot I'm going to right now. Yep, Dr. Dot Hayley VanBeek. So HayleyVanBeek. Yep, that's
And
my
then
handle.
email is Hayley@fuelphysicaltherapy.com.
Yep,
My email's Eric@fuelphysicaltherapy.com. I'll post the links to social media and stuff like that if you are watching and want to follow us there. But thanks so much for coming on, Hayley. And we'll have to do this again soon.
sounds good.
All
Thank
right, bye.
you.